The secondary stress tests, probably the most sensitive one, is the dorsal shear or Stoddard's test. And for this, we'll come in, and I'll show you on this side first where the hand placement is, and I'll do it on the correct side. We'll roll the patient towards us. We'll put one finger on the crest of the sacrum and the other finger on the PSIS. Okay? So we're palpating both the sacrum and the innominate. And then we're going to shear the innominate dorsally and see if we can actually pick up interbone movement. Does this PSIS actually move backwards relative to the sacrum? If it does, it's unstable. So doing it the right way, in this position, we'll flex the leg up, adduct it slightly, roll her across that way, come on, palpate, so this finger's going to go on the sacrum, this is going to go on the PSIS, like so. Roll her back onto your hand, there, stabilise the hip with flexion adduction, there, and then take the slack up in the pelvis by pushing down and watching the pelvis rotate back. And of course there's going to be some slack in the pelvis as you do that and in the bed. So take that up and then apply your stress and feel for that innominate dorsal movement. But you've got to wait until you've taken up all the slack before you apply the stress, otherwise you will feel it moving about. This is one of the more sensitive of the tests. The other test can be done in prone. Lie on your stomach for me. And we can look at cranial and caudal stability. So if I want to test caudal stability on the right side, I can come onto the base, the apex of the sacrum, and here come onto the the PSIS, the superior aspect of it. Come down low on your patient and then shear them on each other. So I'm doing this, which is a caudal shear of the innominate there. And you can check it against the other side, like so. To do a cranial shear, we'll fix the base of the sacrum, come onto the inferior aspect of the PSIS, and again shear that up and compare to the other side, like so. Now you can come onto the ischial tuberosity and do the same test, but you've got to make sure that you're way down low, so it is a cranial shear, otherwise you're going to rotate the pelvis forwards rather than shear it up. So you've got to be careful of that. So we're looking for cranial and caudal stability here. Now, of those three tests, that is the dorsal shear, cranial and caudal shears, you're going to get an idea of whether or not we have an articular instability at this joint.